Landmark bill that requires insurance companies to cover the diagnosis and treatment of autism spectrum disorders. Also in 2010, he created a program called the Partnership for Hope, which has enrolled thousands of Missourians with developmental disabilities in home-based services, eliminating long waits that people once faced for such services. He made Missouri the first state in the nation to reach that goal. In 2012, he determined that it was wrong for the state to delay services and supports for a person with a developmental disability whose caregiver dies, or who becomes incapacitated, or when the person's medical or behavioral condition worsens beyond a caregiver's ability to handle. So he led the effort to allow their immediate entry into services, and again, without a waiting period. I'll just give you two more. In 2013, responding to national tragedies involving the killing of innocent people by troubled young men with untreated mental illness, he set aside $10 million to strengthen Missouri's response to people in behavioral health crisis. And of course, in 2014, he led the successful effort to secure funds for rebuilding Fulton State Hospital, the oldest state hospital west of the Mississippi River. If you're ever near Fulton, I encourage you to stop by and see the incredible construction that's already underway. And the bottom line is that Missouri's public mental health system is stronger and more resilient today than in 2009 when he took office, despite the challenge of one of the worst recessions in history. It's been a true honor to serve under his vision and leadership. So ladies and gentlemen, it's with great pleasure I present to you the Governor of our state, the Honorable Governor Jay Nixon.
Thank you all very, very much. Thank you, Director Stringer, but most importantly, thank you to all the dedicated caregivers and advocates that are with us today. You know, as you look out here, this group is a shining testament to our shared values as Missourians and the shared obligation that we have to our most vulnerable citizens. Growing up in DeSoto, I went to Central Elementary School. Back then, kids with challenges were warehoused in a separate building. And at recess, as you walked from building to building, they were targets of jeers from the students. I remember at a young age, understanding that, quite frankly, that was just wrong. And trying at that young age to do something about it. But that experience taught me some fundamental lessons that have stayed with me now for over 50 years. We aren't all given the same gifts, but we all have the same rights. And our service will ultimately be measured at heaven's doorstep by what we did or did not do to help those in need. That's why as Governor, making sure Missourians with developmental disabilities, mental illness, substance abuse disorders have the opportunity to live up to their own God-given potential, and it's something I've cared deeply about and worked hard to accomplish. I want to thank Mark for his very kind comments. I want to thank you all for helping us execute and begin the execution of significant shifts in important ways in all sorts of modalities of mental health treatments and preventions in our state. And with your help, the list of accomplishments is substantial and getting longer each day. 2 years ago, we saw Missourians with untreated mental illnesses were putting a significant strain on their families, their communities, and local law enforcement. Without access to appropriate care, these folks cycle in and out of emergency rooms and jails, not the appropriate environments for quality mental health care. Too often, as Mark said, the cycle ends in tragedy. So working together, we developed a strategy to begin to break this vicious cycle and connect troubled individuals with the care they need. Working in a bipartisan way, the legislature followed my recommendations to invest more than $10 million annually into addressing this critical issue. And today, because of that effort, we are seeing dramatic progress. We have trained thousands of Missourians in mental health first aid training. In fact, Missouri is the top 5 states for having citizens trained in mental health first aid. We've increased access to proven education programs, including NAMI's Family to Family and Basics. We've expanded crisis intervention training for law enforcement so our local cops know what to do when they encounter an individual in mental health crisis. And I should also note, not only have we expanded that training, I want to thank the Department of Mental Health and many people here who helped to provide that training, but also this year, Director Roberts, Department of Public Safety, as well as the Police Officer Training and Training Commission, added to the training opportunities and requirements for officers, mental health awareness training, de-escalation training, and officer wellness training. We got to make sure that these officers that are oftentimes out there dealing with these issues also are taking care of themselves, because a healthy officer means for better law enforcement too. We have placed 31 new mental health liaisons to work with law enforcement at each of our community mental health centers across the state. Now, over the past 2.5 years, these dedicated professionals have made more than 31,000 contacts and more than 18,000 treatment referrals. Okay? That comes off of, before we started this program, 0. Okay? It doesn't come off of 30,099 and 18,000, because basically before we did this, in a significant way, cops and mental health professionals weren't interacting. We didn't have a way to bridge that gap. And I want to tell you that the cops are so excited to have somebody answering the phone on the other end and somebody knowing what they're doing, trying to deal with folks. We've had folks that have bounced between emergency rooms and jails. We had one fellow who we met with some of their caregivers who had been to jail and emergency room 56 times in one town. Okay? He's now employed. He hadn't been back to either jail or an emergency room, okay? Well, we also knew we needed to help emergency rooms. So we put together emergency room intervention projects in 7 parts of the state to work in partnership with 65 hospitals and health centers. So far, these teams have helped more than 3,300 individuals with the care they need. And quite frankly, I don't have to tell you all this. It's not going to stop me from telling you, but these docs and nurses at these ERs on the weekends and oftentimes late at night, they're there to treat physical health issues. Someone's broken their arm or broken their leg or cut themselves or whatever. And quite frankly, as you all know, some folks present themselves in a pretty challenging situation. These emergency room intervention projects, these 3,300 folks that have made it from the emergency room to get the help they need, find that care they need, let's look at the proven results. There's been a 41% decrease in arrests, a 62% decrease in homelessness in this population, and a 99% treatment program enrollment. Okay, that's off that 3,300. 3,300, you have 41% decrease in arrests, 62% decrease in homelessness. I can't say it's to the homelessness. But a 99% increase in treatment program enrollment. Folks, oftentimes as you're in your last lap in the job I'm in right now, you try to focus on thinking that you've made life different for people you'll never know and you'll never meet. The standard for me is not whether I did something for somebody I know or somebody that asked me directly for their help. The standard at this particular job for me is whether I can make such a large difference with numbers like these, and you all can help us execute them, that people don't even ever think of me. Instead, they get the treatment they need and move on down the line. And as Mark indicated, last year also we broke ground on the side of that new state-of-the-art psychiatric facility in Fulton, replacing the dangerous and decrepit facility that first opened in 1851. 1851. Every 160 or 170 years or so, we need to fix up our building. But much more important in the physical location there, which is beautiful, I want to say 2 things about it. First of all, I want to thank the people of Fulton and Callaway County. Okay, we live in a world where if you say to somebody, look, we want to build a mental hospital in your community, Not just any mental hospital, but the one that's going to take the most challenging cases, folks that are dangerous either to themselves or others. We're going to make it secure. There's going to have to be significant treatment and hopefully some opportunities there for those folks to move forward. Some communities would not take that responsibility. I want to tell you the people of Fulton and the people of Callaway County have warmly received Director Stringer, warmly helped us build up that great staff that's there, really helped us, and is excited by 2017 to be in their community the most advanced location for mental health, psychiatric, challenging services, physical location of anywhere in our country. Now, I'm very proud to announce that this year's budget not only continues these life-changing initiatives, but it also allows us to expand some of this stuff significantly. So, as you can see, we come in, we look at these problems, we try pilot programs, we look at what works. We got to prove to the taxpayers who are going to spend their money that what we're doing is going to be effective. Okay, and that leads us to this year. The fiscal 2017 budget answers my call, for example, for an additional $1.6 million to put ER intervention teams in additional regions of the state. That means more Missourians in mental health crisis getting the care they need when and where they need it. But crisis response is just a part of the solution. We also need a better way to prevent mental health crisis from occurring in the first place. That's why the budget also follows my recommendation to invest an additional $5.4 million to launch a new crisis prevention program for low-income Missourians between the ages of 21 and 35 with severe mental illness and substance use disorders. Okay? Too often, Missourians in the early stages of severe mental illness, especially young adults, can't afford the treatment or medication they need to achieve real and sustainable recovery. This initiative will provide those who suffer from severe mental illness with early, effective, coordinated health and mental health care, such as counseling, medication, the management of that medication, treatment for substance abuse disorders, and even help in finding a job when they're ready. Now, before you all come up to a DMH employee and say, why in the heck is the governor saying only 21 to 35? What about 20? What about 19? Once again, back to the taxpayers. We use money well. We've crafted a waiver that will allow us to draw down federal dollars inside this 21 to 35 area, which will allow this to be done more cost effectively. And if we can get numbers like these we've seen in other areas where we draw those down, I can guarantee you that as years go forward, younger 18, 19s, and 20s will also demand, and in my view, will get those types of services. Please don't yell at Mark or any of the other members of mental health and say Nixon doesn't care about 18, 19, 20-year-olds. It just is, as we move into these areas, getting them put in budget so they'll stay, so it's not a year-over-year fight, and getting them in situations where we maximize other resources is important. But this crisis prevention program will bridge the gap between what we have and what we need, and I appreciate the outstanding work by Director Stringer and his team at DMH in putting all these pieces together. This can be complicated in the funding side, complicated in the execution side, and I want to tell you, Mark and his team have been seamless in their work. All told, put it in context, thank you. Because these speeches are relatively easy for me to give. You know? I just got to read this stuff. But if we're going to really do it, you know, if you're going to just do more than just say it, and you're actually going to do it, we are in fact a show me state. You know, we actually have to do this stuff, and I'm just really proud of it. But all told, this year's budget, passed in bipartisan fashion, passed early this year. Okay, when Illinois doesn't have a budget, Kansas gets announced again this week. They're $75 million short in a month over what their budgets are. Okay, and it's just really nice to be boring. And because we made the right calls in 2009, 2010 to be in a situation as the economy is growing to have dollars to invest. Okay, this is not, we're not here by accident. But that 200 million, we just talked about that. Now, another important step we're taking is to help young Missourians in crisis is a greater recognition of the need for school personnel to understand the issue of suicide. This year, the legislature worked together to bring to my desk House Bill 1583, which allows 2 hours of youth suicide awareness and prevention training to count toward the annual professional development required by the state. That's good, okay, it's helpful. This legislation also directs the State Department of Education to develop guidelines and training materials on this issue and to require each school district to have a policy in place by 2018 on youth suicide awareness and prevention. In addition, House Bill 1583 clarifies and strengthens our laws against cyberbullying, an incredibly important emerging issue. This is an important piece of legislation we worked with to get done this year. So I figured if I was here, while I was here, I may as well make some law. So I'm going to take 30 seconds off of my speech here and slide over here and sign House Bill 1583 and make sure you all know it's the law of our state. Now, I'm getting to the end, so don't worry. It's a little cloudy outside, though. You're not missing it. It's important to note that the landmark investments, $200 million I talked about, that we're making in our mental health system this year, also includes funding for Missourians with developmental disabilities. And I want to tell you something else. On all these fronts, there's dollars in here for the dedicated men and women that actually care for them. Okay? It is, if we are going to expand these kinds of opportunities at state level, then we also have to make sure that the careers inside this are compensated well enough so that people will engage in those professions. Millions of dollars for what we call rebasing, which is equalizing areas so that the salary grids make sense, and then the increase in dollars there for those line workers that'll be out there. It's just extremely important because we're going to have, with the things that we have done, we're going to have huge skills gaps if we don't watch out. We're not going to have enough certified, prepared professionals to do the vital work that's necessary. And in order to make sure that you and your friends and neighbors and other people that have taken this on as a career are compensated, but equally importantly, to make sure that the next generation who are in middle school or high school or first year of college or whatever and thinking about a career, that these are careers that can be life supporting, that you can actually have these jobs and make enough money so that you can, live a life. Really important. So, according to United Cerebral Palsy, Missouri has risen to third in the nation and second most improved for providing high quality developmental disability services. That's, those of you who know me know, if you come to my office, I do not, getting third is great. The huge progress you made to get third is really nice. But I don't have any bronze medals hung up in my office, We aim for Liz 2 spots higher. We're going to keep doing that. When I first took office more than 7 years ago, Missourians with developmental disabilities had to endure agonizing delays for in-home services. Together, we brought that waiting list down to 0. And under the budget that I've signed, we're going to keep it that way. 7 years ago, institutional placement was the only option for too many developmental disability disabled Missourians with families overwhelmed by responsibilities for their care. Today, the Partnership for Hope is changing that. We're keeping families together and helping thousands of Missourians live full, meaningful lives. I had a chance in Jefferson County to meet with a fellow that, because of Partnership for Hope, was literally outside of his home to see me and the other folks that were there for the first time in basically 5 years. And it won't be the only time he gets out of his home yet. 7 years ago, most insurance policies didn't cover ABA treatment, and as a result, families that needed it couldn't afford it. Today, we passed autism legislation, landmark legislation. Today, thousands of children on the spectrum are getting the therapy they need. Literally, as we're here right now, because of our ability to work together and get that done, thousands. This budget also answers my call for a more generous compensation system for our outstanding network of mental health and developmental disability providers. And as we dramatically expanded access to these life-changing services, as I said before, we got to have a compensation system that rewards the dedicated men and women who provide these services, and these additional resources will help move us forward in that area. We have an obligation to pay all of our frontline caregivers fairly and encourage more young people to pursue careers in this rewarding field. They deserve it, and it's the right thing to do. Now, before I conclude, I want to say 2 words to everybody here. Thank you. In the past 3 decades, I've had a unique career. I've had an opportunity to serve in the state senate, the attorney general of the state, be only the 4th person since 1821, became the state, have consecutive terms as governor. And I have learned a lot from the people I've had the privilege to serve. I've learned that Missourians are stronger, more resilient, and more generous than anybody could ever imagine. I've learned that it's the folks with the greatest challenges that oftentimes have the most to contribute. You just give them a chance. My mom taught kids with developmental disabilities. In fact, after she was diagnosed with cancer, she asked for a demotion as an administrator to go back into the classroom. She wanted to spend whatever time she had left directly with young folks that she thought she could make a difference with. She gained as much strength and inspiration from teaching them as they gained from her. I only say to you all, the same is true for me. To make these challenging decisions, to take our state and put us on a much different positive path forward on mental health. The inspiration I have gotten for that is the people you work with every day. Families that get up, the individuals that get up and compete in their lives each and every day. My mom passed away before I became a state senator, but I'm still trying to live up to her expectations and ideals that we have an obligation to serve all Missourians. That's an obligation each of you is part of meeting every day. And so, I'm just really grateful for that. Each of you, everyone here, has answered a very high calling. There are no easy jobs in this audience. Okay? There are no non-work positions in mental health. There are no, wow, I'll just clip coupons, make my salary, and watch Cardinal and Royal games on the internet jobs, okay? They didn't like that. What you do day in, day out, year after year is difficult work, important work. So on behalf of 6 million Missourians, I want to say those 2 words again. Thank you. I want to thank you for your selflessness, your dedication, your commitment. But together, we have a joint responsibility to continue to build a brighter future where Missourians with mental health challenges can step out of the shadows and into the light, where all Missourians have an opportunity to live up to their God-given potential. So, on behalf of 6 million Missourians, I thank you. As a person, I thank you. And please continue to help us lead collectively, equally, if not more important, each of you individually, the people you interact with each and every day. Thank you for what you do. God bless.
So, we have Bobby Joe Reed and Lisa Francis make their way